Hi, good morning, Parker. My name is Solly McLever. I'm your invigilator for the OET speaking session conducting on the 18th of February 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Parker Hopkins.
And what is your candidate number, please?
My candidate number is 233078198.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What are the most important values a nurse must demonstrate in the job?
The most important values a nurse must adhere to in their work are compassion and empathy, working together with other healthcare professionals, respect and dignity, everyone counts, a total commitment to high-quality care, and working to improve people's lives. Compassion and empathy are needed because patients are often going through a difficult time, and you must show genuine understanding and that you care. Respect and dignity apply to both patients and work colleagues. Everyone must always be valued, included, and respected. Everyone counts means that you must provide the same level of attention, treatment, and care, regardless of who they are or their background.
How would you handle a patient who constantly complains about pain?
In this situation, I would take the following course of action. First, I would bring this concern to the attending doctor and make sure that the patient's pain was being managed in the most effective way. Secondly, I would reassure the patient that everything possible was being done to alleviate their discomfort. And thirdly, I would listen sympathetically to their complaint, reassure them that their concerns were being heard, and that we were doing everything possible to help them.
Can you tell us about a time you think you failed and what you learned from that experience?
When I was in college, I started to learn another language. But at that time, I didn't take it very seriously because I was so focused on getting my degree. As a result, I dropped the class without ever learning how to properly communicate in that language. Nowadays I realize how useful it is to speak another language fluently, especially when working as a nurse. That's why I have started my studies again and now I'm really applying myself.
In your opinion, what is the most difficult part about being a nurse?
I feel too responsible for the well-being of my patients. And for that reason, it's hard for me to leave work at work. However, that makes me more organized and even more dedicated. I always instruct the other nurses with every detail about that patient, so they will be in good hands while I'm not there. In my opinion, the hardest part of being a nurse is to have a patient who is in a lot of pain and I am unable to make them more comfortable. I believe that in these situations we must communicate with the doctors and understand the patient's conditions the best way we can.
How would you deal with family members who are not cooperative and want to blame you?
First of all, I would keep calm. We must understand what people are going through and how this situation may be difficult for them. I would explain to them the treatment we are providing for the patient and be very clear that we are doing the best we can to care for that patient.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, good evening. My name is Parker Hopkins, one of the nurses in the emergency department. I really apologize for making you wait for some time. The emergency department is more busy than usual. I hope you can understand the situation. Well, may I know your full name for the record, please?
It's okay, nurse. I understand the situation. My name is Sally McClever.
I really appreciate your understanding, Sally. Thank you for your patience. May I know what brings you here today?
I am here because I fell down the stairs. I heard and felt my toe crack. I cannot bear weight or stand on it, and even unable to wear a shoe.
I'm sorry to hear that. Let me have a look at it, Sally.
Sure. See, nurse, it is black, swollen, and at a strange angle. It is broken, right?
Well, Sally, I acknowledge that your toe is badly injured. Even though it is black, swollen, and slightly turned, I cannot say 100% that it is broken.
Oh, no. What can be done now?
Don't worry, Sally. Whether the toe is broken or badly injured, in both cases the treatment procedures are the same.
Oh, is it?
Yes, Sally, the procedure is that we will dress and tape it to the next toe.
Okay. I trust you. Nevertheless, can I have an X-ray, as if I was waiting here for quite long and at least for my satisfaction?
Sally, I really understand your point of view. Please listen to me carefully. I'm not denying diagnosis for you. This is just because the hospital is busy with emergencies tonight. The fact is that an X-ray would mean a very long wait again. And also, an X-ray has no bearing on your treatment.
All right. It's okay for me, nurse.
Sally, it's a very respectful act from your side. I'm very pleased by your cooperation. Thank you for your understanding of our situation.
No worries, nurse. Well, may I know how long will it take to heal with the standard procedure?
Sally, it usually takes about 6 weeks to heal, if cared for properly.
6 weeks. Okay.
Sally, I will provide some tips for caring for your toe. Shall I proceed?
Sure, you may please.
Firstly, place an ice pack on your injured toe every 20 minutes for the first few days. Secondly, elevate the foot above the heart level to reduce swelling and pain. It can be done by placing your foot over pillows while in bed, and placing your leg over a small stool or table while sitting. And most importantly, try to rest your feet as much as possible.
Thank you for your information. I will follow your instructions, nurse.
Glad to hear that, Sally.
Nurse, what to do if I am still in pain after a few weeks?
Sally, you will be provided with pain medications. Ibuprofen and paracetamol will be enough in the usual situation. I can assure you that these pain medications will relieve your pain.
Okay.
Though, in the worst scenario, if the pain continues even after 2 to 3 weeks, a consultation with your GP is essential.
All right. I will, nurse.
Do you have any other concerns?
No, nurse.
Great. Please feel free to contact us if you need any clarifications. I wish you a speedy recovery, Sally.
Sure, thank you, nurse.
You are welcome.
That is the end of your OIT speaking role play. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.